Bismillahirrahmanirrahim. Auzubillahi minash-shaytanir-rajim. Bismillahirrahmanirrahim. I start the CME with the name of Allah, who is very merciful and very kind. CME update by Mother and Child Survival Group of Pakistan. CME Dr.Tariq Masood Khan, Ops Gynae Family Emergency Specialist, Gulf KSA, presently working as District Gynecologist. Topic for today is a 32-year-old woman concerns about her post-coital bleeding, as she fears that she can have a cancer cervix or genital tract. Well, such an issue to be dealt with, collecting all the detailed informations and assessing her and the nature of her complaint, about what are the causes of these PCBs, post-coital bleeding, that is infection, genital tract trauma, endometrial polyps, cervical polyps, ectropion, and other things, and especially malignancy to be ruled out. Her concern to be readdressed and has to be settled as per her expectations and her wishes. Of course, the pregnancy has to be ruled out. The nature of menstrual bleeding, intermenstrual bleeding, post-coital bleeding, all has to be assessed, and for that the amount, color, the frequency, and the duration be noted. The quality of discharge and its nature, its any smell and any associated factors, itching, for example, burning, and blood stained, and any pussy discharge, all or a serious one to be noted. Ask about the smears history and history of contraception. As I told you, pregnancy must have to be ruled it out, and then all relevant investigations to be taken out, routine and the basics one, and the specific one, especially when considering the intermenstrual bleeding, and patient to be asked to have any bleeding or hematological disorders, and also patient is on anticoagulants. A malignancy as a part of it, as it is feared by the person, must have to be ruled it out by assuring her and by taking her smears and swabs. Then regarding we have to check the discharges, the history of the history of contraception pills and smears are very, very important in it. The examination is also has to be taken out, the abdominal examination, the bimanual examination, and the Cusco speculum examination, which will show vulvitis, cervicitis, and ectropion, and any cervical tears or any cervical cervicitis, and if it is due to chlamydial swab has to be taken. For that, the high vaginal and lower vaginal swab has to be taken for the infections. Then we have to, as told, the pregnancy must be ruled out, serum beta HCG has to be done, and then comes the ultrasound, the transvaginal ultrasound and the abdominal ultrasound. Both can pick any lesions regarding this, any fibroids, any polyps. Important are the cervical and endometrial polyps, and if they are cervical polyps, they can be avulsed and then hysteroscopic examination can be performed. If this post-coital bleeding continues, then stereoscopically we can take endometrial biopsy in the proliferative phase of the cycle. As told you, the infections and the other infections are the hallmark for intermenstrual bleeding and this post-coital bleeding, and for that appropriate antibiotics and after the cultures can be started. Ectropion as a cause of post-coital bleeding is 5% cause, can be dealt with local cauterization, electrocautery, and with the ablative Meyers. So this is one of the important issue of PCB, cervical ectropion, and its solution is ablative methods or electrocautery. Swabs, I have told you, high vaginal, low vaginal, chlamydial, gonorrhea, and these are the infections which are sexually transmitted disease, and for that the contact partner need to be traced. As told you, the cervical smears history and contraceptive history is also very important, and cervical smear has also been taken so as to rule out to have CIN 1, 2 and 3, and then the results and the treatment interpreted according to that. And the important things are the swabs to be taken, as the infection is the main cause, and swabs are the one for the high vaginal swab and the other for the gonorrhea and the other for the chlamydia. And then we can start as these gonorrhea and chlamydia are sexually transmitted, so then we have to start the proper antibiotics according to that. In these we have tried to pregnancy to be ruled out, smears has to be taken, and a history of anticoagulants and other bleeding disorders to be sorted out, and local pathology, cervicitis, cervical polyps and other, and to rule out the malignancy. That is the most important, and that is the main concern of the patient's symptoms, and has the reassurance for that all after doing all this to be given to the patient. So takeaway lesson is pray, praise, trust, love, talk, worship Allah, follow Rasulullah sallallahu alaihi wasallam, our health and survival, and then we should not forget our glorious past. दुनी में इनकी ठोकर से सहरा और दरिया सिमट कर पहाड़ इनकी हैबत से राई, and always we should ask and pray and trust and love Allah. हम तो माहिल बकरम हैं, कोई साहिल ही नहीं, मंजिल किसे दिखाएं, कोई रहबर मंजिल ही नहीं, दहर में इसमें मोहम्मद सल्लल्लाहु अलैहि वसल्लम, लाखों दरूद उन पर उजाला कर दे. और and then we have to our glorious past, the greatest Muslims, दी अजानें कभी अफ्रीका के तपते हुए सहराओं में और कभी यूरोप के कलीसाओं में. सरजमीन उंदलस, वो दिन है याद तुझको, उतरा तेरी सरजमी पे जब काफिला हमारा. With that we will come with another review. Best of luck, regards, thank you very much. वमा अलैना इल्लल बलाग.